Hey everybody, James here. It's March 10th, 2013. It is 3 days after my very first chemo treatment. I want to take a few minutes in this video right now to describe what the chemo treatment visit was like and describe the immediate effects that I faced immediately after I came home from my chemo visit and what the last few days have looked like. I'm very worn out, as you can see, probably by the look on my face, but I still remain optimistic that I'm doing what I need to do to take care of this cancer. The chemo visit was a marathon, to say the least. I arrived to the chemo infusion room at 9 a.m. and did not get out of there until 6 p.m. As I mentioned a video or two ago, the first round of chemo treatment, and it was as I mentioned, it was a 5-course drug cocktail of drugs, I should say. They have to be infused really, really slowly to make sure, as I mentioned, that there's no allergic reaction. So as a result, it took 9 hours to get all the chemo into my body. A very, very long time. I was one of the first to arrive, and I was definitely the last one to leave right before the final nurse left the building. The chemo itself was fairly uneventful in terms of what I was feeling at the moment. I mean, I had the chemo IVs directly into my port here. They started at 9 with a bunch of pre-medication to include some anti-nausea, a bag of anti-nausea meds, a bag of antibiotics. I think I took some Tylenol, a bunch of pre-meds to help subdue the side effects that will be or have been now imminent after the chemo treatment was done. So after about an hour or so of pre-medications, the chemo began, the actual drugs, and like I said, it was fairly uneventful. I sat in a very comfortable chair. My wife Janine was by my side the whole 9 hours. And we talked, and I talked with other patients that were in the chemo infusion room as well. It was very interesting the way the chemo infusion room was set up. It's not like you're in a private room looking at 4 walls. There's a lot of windows, and you're sitting in these pods where there are 5 other patients, or 5 other cancer fighters, I like to say, who are getting their chemo also at the same time. And there's probably about 4 or 5 pods in this large infusion room. So in any given day, there's probably anywhere from 12 to 18 chemo fighters, or pardon me, cancer fighters getting their chemo. So it was interesting. You know, one thing I did note that, as odd as this might sound, although it may not, I was definitely the youngest one in the room, and I think that's because the pediatric folks, the kids that are getting chemo, are probably in a different wing separately. And so I definitely brought the age demographic down in that chemo room by about at least 20 years. So it was interesting to talk with some of the older folks about their experiences and where they're at in their cancer fight and journey, and where they're at in their chemo. And it was just really kind of enlightening to be able to share stories with folks that are enduring the same sort of thing that I'm enduring. So that was 9 hours of that kind of talk. It was okay. A little after 6 o'clock, I was on my way home from the chemo treatment. Made it home, and I started just not feeling right. I should say that the side effects of the chemo, in terms of the extreme nausea and the potential vomiting and the fevers, etc., were not supposed to really hit. They don't hit most people until a day or two after the chemo is done, or after the treatment is done for that round. And for me, I started feeling just not myself about an hour after my chemo was pulled from my port. I started getting the shakes. I was incredibly cold, and so when we got home, I needed to take some steroids that were prescribed, and I needed to do so with something in my stomach. So I had a bite to eat, 2 bites in fact to eat, and my wife put me in the bathtub because I was so cold. She wanted me to warm me up. It wasn't about 5 minutes or so in the bathtub when I just started vomiting uncontrollably all over. And I know that's a gross picture to kind of think about, but that's the reality of it. Now I mentioned they gave me some anti-nausea medicine, but that was 9-10 hours earlier in the day, and so unfortunately the anti-nausea medicine had worn off, and I had not taken my anti-nausea pill yet because we did not expect that to need to be taken for another 2 hours after I got home. So needless to say, here I am sitting in a tub of warm bath water and surrounded in my own vomit. It was it was not a pretty sight at all. Well, got out of the tub. Janine was able to help clean me up, and we had our little baby boy Ryan with us, and it was about his dinner time and getting him ready for bed, and I was just in no place to be able to help out at all. About 10 minutes after that first vomiting episode, I'm laying in bed and I feel it coming on again, and I had another round of vomiting. This time it was everything that was in my stomach from that entire day. I must have filled the bucket halfway full. It was violent. It was awful. I would not want anyone to have to experience that. And I know that there are people watching this video that may be about ready to go into chemo, and I don't want to psych you out with anticipation of vomiting. In retrospect, what happened was they probably should have given me anti-nausea medicine a little sooner than when I went home, but certainly not only right before my 9-hour treatment because it wore off. The trick is if you can stay ahead of the nausea with your medication, then the vomiting will likely not occur, and if the vomiting doesn't occur, then you'll feel relatively okay. I mean, gross, but not nearly as bad as you would if you have high nausea and lots of vomiting. So you'll be okay to stay ahead of your nausea medicine. I was not in that boat. My nausea hit me hard when I got home. I vomited twice. After the second episode of vomiting in about a 15-minute period, we called the oncologist who was on call for a consult, and he said, go ahead and take another anti-nausea medicine and see if that works. I took that. 10 minutes later, I was vomiting again. Called the oncologist again. That was on call, and he said take a different type of anti-nausea medicine that I had on hand. So I took that, and it wasn't 10 minutes later that I was vomiting again. So needless to say, after 3 oncology on-call doctor calls, and after 5 vomiting episodes within a period of 1 hour, the doctor on call said just to go to the ER because there was no way I was going to be able to get ahead of the nausea and ahead of the vomiting at this point without some help with an IV, and also that I was becoming incredibly dehydrated, as you can imagine, with that kind of vomiting in that quickest time. And I was still having the shakes too, so I was just in a very, very, very bad spot. I was not a happy camper, to say the least. Thursday night into Friday morning. So Janine was able to find a family friend who came out to watch our baby boy, Ryan, so that she could take me to the ER. And we went to the ER. And it's amazing. As soon as you say the word cancer and chemo, you don't have to wait in that line in the ER waiting room. You get triaged. I got triaged pretty quickly. I was in a bed in the ER within about 25 or 30 minutes. And that's when they started giving me injections of anti-nausea medicine. Unfortunately, about an hour after the anti-nausea medicine, I was not able to keep anything down still, and I vomited again. So I was just not in a happy place at all. It was actually really bad. But by about 2:30 in the morning on Friday morning, I was able to. My nausea was still present, but it was more subtle than it had been before, and I hadn't vomited in a couple hours. At that point, they filled me up with hydration, with saline through an IV. I went through 2 bags of that to get myself up and running again, and then they released me to go home. And I spent the next that whole day, all day Friday and all day Saturday, yesterday, in bed, just kind of dealing with the side effects of the chemo. I hadn't vomited since that night in the hospital, but the nausea was okay. It was present, but it was manageable. I was able to get ahead of my vomiting with the anti-nausea medicine, which was great. And like I said, the last couple of days have been pretty good. I've been fairly tired, and I've been drinking a lot of fluids, obviously, to kind of push those chemo drugs out like I'm supposed to. But today I'm out of bed, and I made it on a 10-minute walk to the park with my wife and boy, and my parents have come out, and they have been a tremendous help over the last couple of days, and they anticipate being here for several more days too to help me get through this hump. So I'm so appreciative of them and for their love and support as well. And my brothers have been calling me and visiting with me every day, and they're ready to come out anytime as well. So between the family and my friends who have been stopping by and calling and visiting, it's just been really, really remarkable, really good. So I anticipate that I might have a couple more lows here in the next couple of weeks. The reason being, they said that my white blood cell count will be fairly depleted here 7 days after treatment, which puts us at about Wednesday or Thursday of this coming week. And so I'll be highly susceptible to infection. I try to hang low as best I can. They did give me a shot. I forgot to mention I went in for a white blood cell count booster shot, if you will. They shot me right in the stomach, and that's supposed to expedite the regeneration of white blood cells so that when I am at my lowest low here in about another few days, that drug or that injection should start working. And I'll explain what that is at another time because this video is getting kind of long. But just wanted to check in with you, let you know I'm alive and I'm doing fine now and I'm in a better place today. And I will check in with you again here in a couple of days. All right. Thanks for your continued prayers. Talk to you later. Bye-bye.